It's Monday Night Spark. In this video, we are going to be talking about 5 things you need to know about iliotibial band syndrome. Hey everyone, I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy, where we help keep active adults and athletes healthy, doing the workouts, the sports they love, without pain, rest, or multiple trips to the doctor's office. So I just had my tea here, got my little Aladdin mug. We're big Disney fans, for those Disney fans out there. Nice little mug here. Aladdin was a great movie. If you guys checked it out a couple months ago, did a nice remake of Aladdin. We are coming fresh off the heels of the Sea Leg Shuffle yesterday, 10-miler. It was a great day. It was definitely a little bit hot, but it was a great race overall. I got to meet up with a lot of local runners here in Connecticut that are a part of our Healthy Runner CT Facebook group. So there's a free Facebook group for those of you that are not aware. And maybe this is your first time checking out some of the videos and some of the content that I'm providing for you. But I would, if you are interested in anything that we talk about today, head over to Healthy Runner CT Facebook group. Just type it in the search bar and you'll get some information about what we do in that group. But it was great to meet up with some local runners over in Guilford there. We actually did a group warm-up, so we went for a nice jog together as kind of a team, and then we went through a dynamic warm-up together. So I know a couple of runners really weren't sure what they should do prior to the race, so we went through a nice group warm-up together. It was nice to see everyone. It was a bunch of Spark winners there, and we had a couple of people in the group place first in their age group, so shout out to them. That was pretty awesome. It was definitely a hot race. It's summertime though, what do you expect, right? Mid to late July. So my time wasn't, obviously the best, but I feel pretty good coming out of the race as far as I'm healthy. So that's actually the genesis of what we're going to talk today about, is one of the most common overuse injuries in runners, which is iliotibial band syndrome. So what we're going to talk about in this video and in this live tonight is what is iliotibial band syndrome, how do you identify if you actually have it, and then what are the common causes, as well as how do you treat it, and then more importantly, what I really focus a lot of my efforts on is how do we prevent it? How do we continue running, hitting the pavement, getting in those miles, training for our full marathons, training for our half marathons without getting this knee pain? So guys, you're jumping on here strong. If you're jumping on here on the live, just type in live into the comment box. And if you have a question about knee pain, or you're struggling with knee pain, or you've had iliotibial band syndrome in the past and you don't want it to come back, drop your questions in the comment box. I will answer them here on the live. If you're watching this on the replay, just type in replay and I'll give you a shout out, and at least I know that you did watch the video and it was helpful for you. So we got Eddie Scotty here on the live. We got the Mecca, Eddie Scotty, here on the live. If you guys did not check out that video, this is my Uncle Eddie Scotty down in South Carolina. He's killing his fitness goals. He's in the gym 5 days a week. He's made some significant transformations to his life. He's feeling better, stronger, better mentally. I'm so proud of him that he's on a consistent, kind of healthy track and a healthy basis. So thank you guys. If you're here again on the live, so I know you're here. I see there are a couple of viewers. Just type in live so I know it is you that is here on the live. And then we're going to get into our content for tonight. Jeff, what's up, Jeff? Thanks for jumping on here on the live. So Jeff's really looking to try and prevent iliotibial band syndrome for his next marathon. So Jeff, if you don't mind sharing, have you had this condition in the past, or are you just looking for ways to kind of prevent it? Have you had runner friends of yours that have had this condition before and you just honestly don't want to get it? You just heard it's not good news, and you're just looking for ways that you can prevent it. Just let me know. That will be helpful and will help shape some of the conversation for tonight. So Uncle Eddie says, go son. All right, there we go. Pump it up from the Unk. So let's get into the first topic here is what is iliotibial band syndrome? So this is the most common overuse injury in runners. The iliotibial band is an actual connective tissue, and it connects to the muscle that starts at your hip. So the muscle in your hip is called the tensor fascia lata. So it is not a drink at Starbucks. It's otherwise known as the TFL muscle. It's a small muscle on the outside front part of your hip, and that connects to the iliotibial band, which runs down the side of your thigh, and then that connects into the bone that crosses the knee joint. So where you really run into the problems, and we'll get into the symptoms, but is where it crosses the knee joint area. So that's where we tend to run into this syndrome, but it is connective tissue. So it's not an actual muscle. That's why it's called a band. It's like fibrous connective tissue. It's kind of like the fascia, which is almost like the saran wrap over our muscles. It's some of that fascia, and it's more of like hard connective tissue, not so much a muscle. So that's why it's going to be really tough to stretch this structure, because the majority of it is a long band, and then you got this small little muscle in the hip. So the muscle in the hip, technically you could stretch, but the band itself really doesn't deal well with stretching. Iliotibial band syndrome is more common in females, so we know that, and the rationale or the reasoning for that usually is because females do have a wider pelvis, because they have the joy of bringing in babies into our lives, right? So because the pelvis is wider, unfortunately, it puts them at a biomechanical disadvantage, especially for running. So that is why it is more common in females than runners. So we got a couple more people here on the live. Brian's here on the live. Sundar is here on the live. Chris is here on the live. Chris, what's up? Thanks for joining in. And Jeff says that yes, he suffered in his last marathon last January. All right, so Jeff has suffered iliotibial band syndrome last January during his marathon training. So hopefully today, Jeff, some of the things that we're going to talk about, especially when it comes to prevention. So kind of stay tuned to the last point is where I'm going to talk about prevention. Hopefully that's going to be able to help you stave off having this happen again during your training for your next marathon. Let me know when your next marathon is, so we have kind of a gauge of how many months out. I'm not sure. You might have already told me before you may be running Hartford, but let me know if you are, what marathon you are running. All right, so how do you know, or how do you identify that you have iliotibial band syndrome? So the symptoms that you're going to have, or the pain you're going to experience, is going to be on the outside of your knee. It's going to be very pinpoint specific. So it's not all over the knee, it's not the front of the knee, it's not the inside part of the knee. It is localized to the outside part of the knee. So you have pain, pinpoint specific, outside part of the knee, and sometimes people can confuse this. They might think they have a meniscal tear. So I'm sure you've heard about that before, tearing your meniscus in the knee. A meniscus tear is completely different, and how do you differentiate the two is meniscal tears are usually the result of a specific incident, trauma. You twisted, you landed on your knee wrong, you were playing pickup basketball, you landed wrong on the knee and you felt a sharp pain. It will usually be associated with clicking, or catching in the knee itself, and most likely it would have swelled up after the incident. So iliotibial band syndrome is something that comes on progressively. So we call it insidious onset. So it comes on over time. So you're running, maybe you feel a little bit pain one day, gets a little bit worse, you ramp up your training, and now it's really full-blown, highly irritable. So now you're in a lot of pain, and now it's really limiting your running, and it's pinpoint specific right on the outside part of the knee. Then that is iliotibial band syndrome. So the question is, do you need imaging? Meaning, do you need an X-ray? Do you need an MRI to diagnose iliotibial band syndrome? No, you do not need either of those. Like I said, the history in of itself is usually a clear giveaway, and then a good physical exam by your running physical therapist will help differentially diagnose and rule in that you in fact have iliotibial band syndrome. An X-ray will not show anything. X-rays show bone. It won't show the IT band at all. An MRI would show the IT band, but what's it going to show? It's just going to show that maybe if you've had it for a long time, then it's just going to show some degenerative changes or the connective tissue. There's like a chronic inflammatory phase that's going on. It's not going to change the course of your treatment at all. There is no surgery for this condition, so you do not need an expensive MRI and waste your money on that. So that is the point of where you need to go see your physical therapist and get PT first before you actually go see an orthopedic specialist. So physical therapists are trained to pick up on this condition. I just pretty much told you that it's pretty simple to diagnose based upon the history, and then a couple of quick tests that we do on our physical exam, and then a good physical therapist will actually start treating you, get you going on the right path right away without needing to wait and be referred to another specialist and then wait another week to get into physical therapy and then be able to get yourself treated. So if you guys are aware that you are able to go see your physical therapist without needing to go see your doctor or an orthopedic specialist first before you get your knee pain checked out, then just comment PT. I always love to kind of hear how many people out there actually know that they can go see their physical therapist without needing a referral to a doctor. It's been, in the state of Connecticut at least, it's been about 14 years now that we've had what we call direct access, meaning you do not need a prescription to go see your physical therapist in order to actually get diagnosed with your condition, your pain that you're having, and then get treatment started right away. So let me jump on here, catch up. Megan, what's up? Good seeing you. Thank you for jumping on here. Crystal's on here on the live. Sundar's on the live. And also Jeff says that yes, so we already got that. Okay, so he's running New York in November. All right, so there's a couple of runners I know that are running New York in November. So good luck. Your training is well underway at this point. And Lindsay, thank you for jumping on. What's going on? Good to see you. So Jeff, yeah, hopefully we're going to be covering those tips today. So we talked about already what is iliotibial band syndrome, and then how do you identify if you have it, and then actually talking about how you don't need a prescription if you have the pain that I was describing. Go and see your physical therapist. I would recommend, especially if you're a runner out there and that is the pain that is bothering you, go see a physical therapist who specializes in working with runners, and they will be able to help you out as best as possible. So if you are jumping on here on the live, just type in live. Also, if you have any questions, I'm happy to answer any questions you have regarding any running-related injuries, and specifically regarding our topic tonight, iliotibial band syndrome, or if you've been battling knee pain and you want some guidance on that, I'll be happy to answer those questions here on the live. And if you're watching on the replay, just type in #TeamReplay, just so I know you did watch this. So now let's go into the causes. So what causes iliotibial band syndrome to occur? So it is mainly a repetitive overuse injury. So it's when your knee is bending back and forth, so it's going from bent position to a straight position, bent position to a straight position. So very common in cyclists as well as runners. So if you think about, you're doing a repetitive motion, every step you take, you're bending and straightening your knee. So for those triathletes out there, I see a bunch of you guys as well. Unfortunately, you have two of those sports that can cause this condition, so you need to really be careful and pay attention to the prevention steps that we're going to be talking about a little bit later on. So especially when your leg is rotated inward, so when you're bending and straightening and your leg's rotated inward. So if your alignment is you're more of an overpronator, so your foot flattens more, you got flat arches, and your foot goes through a lot of pronation when you're running, and that causes your leg to rotate in, then that can cause this condition. So other things that can cause this is the surfaces that you're running on. So specifically, number one, footwear. So if you're getting your sneakers that are wearing out on the outside part of your sneaker, that's usually a telltale sign that you're rolling in too much. So if your sneakers are wearing out, if you're running on a lot of country roads, so the surface of the road is banked and there's a huge like camper in the road, and obviously you're being safe and you're always running into traffic, never with traffic, right? You're always being safe and you need to run into traffic. You're always going to have one side that is higher than the other, and that leg is going to rotate inward more so. So usually one side will rotate inward and the other side won't need to because the height of the road is a little off. So if you're doing a lot of miles on country road where you're really having that banked surface, then that can be a contributing factor and cause to why you're getting iliotibial band syndrome, as well as if you're doing a lot of miles on the track and you're running in one direction on the track, then that will tend to have one side rotate in. So those can be some of the causes of why you get iliotibial band syndrome. So if you guys have had this happen before, or you've run on a lot of country roads and you're wondering to yourself in your mind, saying, like, I feel off balance. Like, I feel like one side's higher than the other. I actually felt like that yesterday running the Sea Lake Shuffle. There were definitely some roads there in Guilford that were like pretty high camper, kind of a high bank in the road. And typically I run in Cheshire here, where I'm pretty much like a Route 10 runner and I stay on the sidewalk. And the sidewalks are flat. So I'm used to running on a lot of flat surfaces. So during the race yesterday, I was thinking to myself as I was running, I'm like, wow, this is really, kind of a big bank. And I was trying to get to like the flat part of the road every time I was running. But if you've been there before and you're running those country roads, just say been there in the comment box below. So we got some other people jumping on here. Linda's here on the live. How you doing, Linda? Good to see you. Thank you for jumping on here. Donna's also here. Hey, what's up, Donna? How are you? So now we're going to get into treatment. So this is probably what you guys want to know about, right? We always want to know, like, how do I fix things, right? That's what you want to know is like the quick fix. So Crystal's been there before. I know I was there yesterday, like I said, in Guilford. But how do we treat iliotibial band syndrome? So a couple points here. First and foremost is you're going to need to back off some of your miles. So if you guys have listened to any of the videos that I've done, every Monday night we come on 8 p.m., slightly after 8 p.m., let's be honest here, 8:05, sometimes 8:10. I do my best, guys. I'm running back here after treating, and I want to hop on, help you guys out. But I'm here every Monday night going live. We've talked about a lot of topics, and if you've listened to any of the other videos, you know my philosophy, and it is keeping you active, keeping you running while you heal from your injuries. So I don't like to say don't run because I don't believe in that. You're not going to shut down running. But what I need you to do, especially if you're having current pain, is to back off your miles a little bit. Because if you don't, then it's just going to keep getting worse and worse and worse. And it's not going to allow time for the tissues to heal and calm down. So that's point number one for treatment is you need to back off your miles. You need to think about those surfaces. So switching up your surfaces if you are in that situation, like Crystal said, she's been there before. Sundar's been there many times, he says, and he's paid the price. And the other thing, Sundar, I was thinking about you as well, because I think you've commented before that you do run a lot of hills, or there are a lot of hill parts around where you're running. If you are doing a lot of hills and you're not used to training hills, and especially you do a lot of downhills, or if you go on like a trail run and you're not used to running trails and on the way you're running a lot of uphill and then you go a lot of downhill, then that can be a cause of getting iliotibial band syndrome. So sometimes I'll see a lot of runners that it comes on like that. They went over to Sleeping Giant and they were running, downhill and they're not used to doing that, elevation and coming down the hill, and then the pain starts. So thinking about your surfaces as far as treatment, whether trying to get more of a flat surface, so trying to seek out areas that have sidewalks like I do, or if you are doing incredible amounts of mileage on the track, then think about what are some safe roads you can do that you can run on versus doing the track. Or if you are doing the track in one direction, switch it up and look silly and go in the other direction, right? Everyone will look at you kind of weird on the track, but whatever, you're giving your leg a break and kind of transferring the load to the other side. So you got to think about your health first and foremost. So if you're getting that pain, especially when you do your track workouts, then think about doing half of the volume going in the opposite direction on the track. If it's shoe wear that's the causative factor and you're not tracking your mileage, number one, you should be. It's so easy nowadays, right? So we all have apps and watches, and I know I use the Runkeeper app, so I just pop in when I get my new sneakers from Woodbridge Running Company. I pop it in there and my mileage will start. Usually, depending upon the size, you want to replace those sneakers every 300 to 400 miles. So depending upon how hard you are on them, what conditions, are you doing back-to-back runs? Do you have two sneakers that you're swapping in and out? So I use two sneakers at the same time. So it does take more of a beating on your sneakers if you run back-to-back days, and then definitely don't leave your sneakers like in your hot car in the summertime, because then that will contribute to kind of breaking down of the cushioning in your sneaker. So there's a lot of factors there, but anywhere between 300 to 400 miles, you definitely need to replace your sneakers. So if you're not tracking your miles, you need to start tracking your miles on how much you're putting on your sneakers, and then definitely just wear your running sneakers for running. Don't wear them for walking around Stop and Shop. Don't wear them for standing on your feet all day. You should have dedicated sneakers to running that you can track the amount of miles that are on your sneakers. So if you need to replace your sneakers, they're worn out on the outside like we were talking about, then definitely replace your sneakers. Lastly, how do you treat? So some of the things that I do is seeing a good physical therapist. There's some definitely manual therapy techniques we may do that we feel is contributing to your actual pain. And then some self techniques that you can easily do that I would give you is foam rolling the iliotibial band. So now, guys, let me get on my high horse about foam rolling the iliotibial band. Please do not do this. Do not roll on the outside of the band down by the knee where you're having your pain, because this will just be extremely painful and you will further irritate the condition and not facilitate healing. What I want you to do with your foam rolling is roll the muscle up at the hip, your TFL muscle, remember that tensor fasciae lata, right? That Starbucks coffee, up at your hip, roll that muscle, good. And then roll slightly in front of the iliotibial band and slightly behind the iliotibial band, which will cause a decompressive effect to the actual band. Do not roll right on the side and go for the kill, and it's extremely painful and you're not feeling any benefit from it. So you need to roll kind of slightly in front, slightly behind, and not go in there for the kill. If you guys, because I see so many runners do this and they just get further irritated, I want to help you guys out. So I have a great video that I did, a how to foam roll your iliotibial band, on my YouTube channel. So if you want the link to that video, I'll be happy to send it to you so you can find it easily. Just type in ITB video. I will send you the foam roll video of how to actually foam roll the iliotibial band, that you will actually benefit from actually loosening some of that tissue, stimulating your nervous system, and doing some of that soft tissue care we've talked about in some previous lives before. So that would be the first big point that you need to do to treat this area, is foam rolling the iliotibial band, but not in the painful spot. The other big thing you need to do is, hold on one sec, just need a little water there, is strengthening the glute muscles. Specifically, the gluteus medius muscle, which is your outside hip muscle. Your outside hip muscle stabilizes your pelvis when you are running and you step on that leg. So every time you step on your leg, when you're running, every single step you take is on one leg. That is the muscle that keeps your pelvis nice and level and prevents it from dropping. When your pelvis drops, if that muscle is weak or inactive, then that causes your leg to go in. Just like we talked about before, when your leg goes in, that contributes to getting your symptoms of the pain on the outside part of your knee. So we want to treat this area by getting down to the root cause of what caused the iliotibial band syndrome and strengthen that muscle, that gluteus medius muscle. You got to strengthen it. So if you guys not sure, how do I strengthen my gluteus medius muscle? How do I strengthen this muscle that you're talking about? Is probably the most important muscle that runners need to actually strengthen and work on, and that is not worked on when you're doing your squats, deadlifts, and any leg press exercise or any exercise that you're using two legs at the same time. Then I will send you a video for that. So just type in hip muscle strengthening video. Or hip video, and I'll get you some gluteus medius exercises so you can start strengthening that muscle. Let me catch up here on the comments. Laura's here on the live. What's going on, Laura? Good to see you. Laura says hi. Crystal says, I do that on the track all the time. I look nuts. but notice the difference. Awesome. So I'm glad that you're already implementing that strategy, that you're going in two directions on the track. So good for you. That's going to help you. Jeff, I will definitely get you that hip strengthening video. I actually have a couple. I'm going to actually put together the activation exercise I like to call the humbler, which looks easy, but when you do it correctly, it is surprisingly hard. And you feel a good burn on the outside part of your hip. So that's how usually a lot of the runners I work with, I get them to find their gluteus medius muscle. They feel that burning in the muscle, they activate it, and then we progress to some standing exercises, which is important to actually have that progression, because when you run, you're on your leg all the time. So that's how the muscle activates. So it's really going back to kind of the tips that I talked about, my 5 tips for healthy running. Live video we did 2 weeks ago, I believe now, is you got to train on one leg. And that's why it is so important to kind of train on one leg there. Nicole, what's up? Thanks for joining. Ashley, how are you? Thank you for joining in here on the live. So that are some of the common areas that is going to help you in terms of treatment. So now let's get down to my passion, and this is really why I've created this whole kind of platform and produced these videos for you, and the YouTube channel with all the videos there. If you guys haven't checked that out, Spark Your Training, all one word, search it in YouTube, or I do think I have the link right in the description of this video down below. Click that link, guys. Head over to YouTube. Consider subscribing if you like any of the content that we're talking about today. If you hit the bell on YouTube, you'll be notified every time a new video pops up, so you don't miss any of the new videos. So if you are watching on YouTube, shout out to you guys on YouTube, and thanks for following, and consider subscribing. I greatly appreciate it. So how do we prevent iliotibial band syndrome? How you doing, Ashley? Ashley gives me a wave. What's up? Ashley, the mastermind, for those that don't know, behind the logo, the Spark logo. Ashley is an awesome graphic designer here in the Wallingford area, very local. She helped me tremendously when I rebranded my business. So any of you out there who are small business owners and you're looking for a good graphic designer who really goes that next level with their clients and gets into kind of what you need for your business and produces stuff in a timely fashion and good high quality work, then definitely reach out to Ashley. She will definitely be able to help you out. So how you doing, Ashley? Thank you for jumping on the live. And so let's get into prevention. How do we prevent iliotibial band syndrome? So first off, this is actually my 5th tip in the healthy runner tips, 5 tips for healthy running that I went over in the live. And if you guys want that free checklist, you didn't check out the video, you want the checklist, type in checklist into the comment box below. I will send you the checklist. But my 5th tip was you got to train smart. So train with your brain, right? With proper progression. So again, not going out there and ramping up the miles super quick, not going out there and doing a crazy hill workout when you've never done hills before, not going out there and you haven't even walked up Sleeping Giant, but now you're deciding to run down it because it's nice outside and you just want to get outside and go for a run. So training smart with proper progression is key, all right? So you got to train smart. You got to be smart about how you are training. That's the 5th tip of the healthy running, right? So now also think about shoe miles. So we talked about that already in terms of treatment. Now we're going to talk about prevention. So now, before you get that pain, take a look at your shoes. Are you wearing on the outside part of your shoe? Are you tracking your miles? Are you like at 500 miles? Go replace your shoes. Like, that's how you're going to prevent this syndrome from happening. Also, key to prevention is strengthening and stabilization. Strengthening your glute muscles. Strengthening your core muscles. Stabilizing those areas. Good core strength, good glute strength is going to help prevent the stress to that band at the knee when you are doing those repetitive activities. Because if you think about it, running is repetitive, right? You're going to run, right? We all love running. We do it. We love it. We understand the benefits of running. And these are going to help keep you healthy to prevent it. So you need to think about, how do I train smarter, right, as you age as a runner and stay healthy so you can be able to train for that full marathon in November. You're training for New York City like Jeff is, right? So you want to be able to train for that race, and you don't want your schedule for you not to be able to hit that long run on the weekends, and you're supposed to be running 14 and you only could run 8 because your pain is so bad, right? So prevent that early on, guys. Dedicate training time. Remember, you got to train in order to be able to run. That was tip number 1 of the healthy runner tips, all right? Train in order to run. So now I want to know, what 2 strategies are you going to implement into your training that we talked about today? Are you going to foam roll your IT band, or are you going to initiate some glute strengthening into your program? So if you're doing the IT band, just type in IT band into the comment box. If you're doing the glute strengthening, just type in glutes into the comment box. I want to know which of those 2 strategies that you learned about tonight you're going to implement into your training. So let me just catch up here on the comments. So Ashley says, takes a bow, and Dwayne really ran with it. Great client. Oh, thank you, Ashley. So Jeff's going to think about strengthening his glutes. I'm going to send you that video, Jeff, and then you're going to be able to strengthen those glutes and stay healthy as you're training for New York. So if you guys want to add a spark to your training, and you're thinking about, you know what, I'm having some pain, and I'm a runner, and I really don't know what to do about it. Let's jump on a free 15-minute phone consultation. I'll be happy to jump on a call with you, see if it's the right fit for us to meet in person and go through an evaluation and see if I can help you out with hitting your running goals, getting rid of your pain, and getting you on the right foot, providing you the tools to be able to run and train consistently without having to back off of your training because of pain. If any of the things we talked about today, guys, was helpful for you, please, I just appreciate, hit that like, hit the love button. It will just help the algorithm of Facebook to be able to put this in front of more runners like yourself, because I want to reach as many runners as possible, get some of this information out there, educate you on how to keep your bodies healthy so you can hit the races like the Sea Leg Shuffle yesterday, like all the people that we warmed up with yesterday at the race. Keep you healthy, doing what you love. Again, guys, if you're watching this on YouTube, consider subscribing, hit that bell so you'll be notified of the notifications. And also, if you're looking for a community of like-minded individuals, runners, I was looking for that community, so we created that community with the Healthy Runner CT free Facebook group. Head over, sign up. It's a closed Facebook group with just runners in there, whether or not you're a beginner just starting out with a Couch to 5K program, you need some guidance, you want some guidance, or if you're an experienced runner who's just run your whole life, but you really didn't know what you should be doing. You just ran because you were a good runner, and you ran in high school, you ran in college, and you just continued running into adulthood, but now you're starting to suffer more injuries, and you just think that, hey, maybe it's just because I'm aging. But maybe you're not doing the things you need to do in order to train, in order to run, to stay healthy as you age. So if you're looking for that guidance, head over to the free Facebook group, Healthy Runner CT. Thank you guys again for jumping on here on the live. Sundar says, strength training including glutes, quads, and hammies. Yes, glutes, quads, definitely important. Hammies important, especially if you're susceptible to the hamstring pain that we talked about a couple of months ago. But if I had to prioritize running-related muscles, Sundar, it's definitely going to be those glutes and quads, and probably endurance of your calf muscle. So we talked about in the 5 tips for healthy runners. Those were the kind of the key running muscles that I find weakness in a lot of the runners that I help. Bill, thanks for jumping on here on the live. Good to see you. So thank you guys for jumping on here. Thank you for contributing. Again, guys, if you're watching this on the replay, just type in replay, just so I know you did watch it and this was helpful for you. Every Monday night, 8 p.m., coming to you, Spark Live. Again, guys, I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy. We help keep active adults and athletes healthy, doing what they love without pain, rest, or multiple trips to the doctors. Thank you for tuning in, guys. Until next time, out. Bye.